Ovarian cancer develops when abnormal cells in the ovary multiply uncontrollably and form a tumor. If the tumor is not treated, it can spread to other parts of the body. This is referred to as metastatic ovarian cancer. Ovarian cancer frequently exhibits warning signs, but the early symptoms are hazy and easy to dismiss. Approximately 20% of ovarian cancers are detected at an early stage. Early signs and symptoms: abdominal bloating, pressure, and pain, abnormal fullness after eating, difficulty eating, an increase in urination and increased urge to urinate. While many of these early signs of ovarian cancer can be misinterpreted as symptoms of other, more benign conditions, it's important to remember that with ovarian cancer, these symptoms will be persistent and will be a noticeable change from your normal, day-to-day sensations. Later signs and symptoms: ovarian cancer can also cause other symptoms, especially if it's not caught early. Some of these possible symptoms include fatigue, indigestion, back pain, menstrual irregularities, bleeding outside of your normal cycle, painful intercourse, loss of appetite, weight loss, changes in bowel habits, constipation. The symptoms will persist if they're due to ovarian cancer. As the tumor grows, the symptoms usually worsen. By this point, the cancer has usually spread outside of the ovaries, making effective treatment much more difficult. Postmenopausal symptoms: while many of the symptoms of ovarian cancer are similar before and after menopause, one significant difference is bleeding. You will no longer have your monthly period once you have reached menopause. While menopause is a natural process, if you haven't had your periods for a while and then notice bleeding, it could be a sign of ovarian cancer. It's also worth noting that ovarian cancer is more common in women over the age of 60. Types of ovarian cancer: the ovaries are made up of 3 types of cells. Each cell can develop into a different type of tumor. Epithelial ovarian carcinomas form in the layer of tissue on the outside of the ovaries. About 85 to 90% of malignant ovarian cancers are epithelial ovarian tumors. Stromal tumors grow in the hormone-producing cells. 7% of ovarian cancers are stromal tumors. Germ cell tumors develop in the egg-producing cells. Germ cell tumors are rare. Ovarian cyst versus cancer: while most ovarian cysts are not cancerous, it can be frightening when one is discovered, especially if your doctor is unsure which one you have. There are, however, a few subtle differences. Ovarian cysts are typically fluid-filled, whereas ovarian tumors are solid masses of cells. Ovarian cysts may grow or appear larger or smaller as your menstrual cycle progresses. Tumors that are cancerous do not go away on their own. Your doctor will assist you in determining which of these conditions you may be experiencing. How is ovarian cancer diagnosed? When ovarian cancer is diagnosed in its early stages, it is much easier to treat. It is, however, difficult to detect. Because your ovaries are located deep within your abdominal cavity, you are unlikely to feel a tumor. In addition, unlike other cancers such as breast and colon cancer, ovarian cancer is not routinely screened. That is why it is critical to report any unusual or persistent symptoms to your doctor. If your doctor suspects you have ovarian cancer, he or she will most likely recommend a pelvic exam. A pelvic exam can help your doctor detect irregularities, but small ovarian tumors are difficult to detect. Your doctor may also do the following tests: transvaginal ultrasound, TVUS, abdominal and pelvic CT scan, blood test to measure cancer antigen 125, CA125, levels, biopsy, chest CT scan, positron emission tomography, PET, scan. How ovarian cancer is treated: the treatment depends on how far the cancer has spread. A team of doctors will determine a treatment plan depending on your situation. It will most likely include 2 or more of the following: chemotherapy, surgery to stage the cancer and remove the tumor, targeted therapy, hormone therapy. Can ovarian cancer be prevented? There are no proven ways to totally eliminate your risk of developing ovarian cancer. However, factors that have been shown to lower your risk of developing ovarian cancer include taking oral birth control pills, breastfeeding, pregnancy, surgical procedures on your reproductive organs, like a tubal ligation or hysterectomy.